And so, did you already get it put in? How about that? Did you guys notice that Brian, did he cry? Did it hurt?
Painless.
Painless. Yeah, we use a little butterfly needle, a very tiny gauge butterfly needle, because this is just going to be a short, about a 15 to 20 minute infusion. And Brian will get directly into his vein these nutrients. And for those of you that are not medical, 1 cc is just a very tiny amount. If you've ever seen a syringe, it's just a very tiny amount. But the benefit is that it all gets in. Whereas if you take a B vitamin, you might get an upset stomach. You might not absorb all that you need to get. Dr. Jackson was talking about the importance of absorption of nutrients. When we do IV nutrition, it all gets in. Your cells, in a sense, get bathed in nutrients for the entire length of the infusion and then for several hours afterwards. And so a lot of times in our culture, people want to feel better quicker. We're living in a day and age where we want quick results. And generally, nutrition is not fast. When we work with chronically ill patients, it takes some time to build up nutrient levels. But what we found with IV nutrition, we can go ahead and speed up that process. You've had these before, Brian? How many of you had so far?
I don't know. I think the first time I got it was when I was in 7th grade.
Wow.
So.
Okay, so your dad has always been a big proponent here.
I also think it's a very good experience. It always made me feel better.
Yeah, that's the goal of the IV nutrition, is to improve people's energy, stamina, mental clarity. I notice when I did get the IV essentials, my vision improves. I can notice. Matter of fact, when I first got one, I went home and I was looking at the plants like, wow, that plant is really green. And my wife said, "Are you on drugs?" I said, "No, dear, I'm on nutrients." Nutrients.
What's the range, Doctor, from one IV to another IV?
How often can you get the IVs? You could get them every day. It's really not necessary. A lot of our patients come in once a week for an IV. If they're struggling with a chronic illness, it may be twice a week. If someone's really stressed, they could do it every day. Now, we have developed a program of IV nutritional plans where we have the IV essentials, which I showed you, and this is what Brian is getting. But what we can do is boost that IV essentials with various things. For example, if you're really tired, we can put extra pantothenic acid, vitamin B5, and magnesium in to give you additional energy boost. If you're having trouble with infections, we would add additional vitamin C. Or if you've got macular degeneration or some kind of visual problem, or your selenium level was low, like what we showed up on the screen, that person could get their selenium level built up much more quickly if they did the IV essentials plus some selenium. Calcium, when you give calcium, it has a very calming effect. So when we have people come in really stressed out, a calcium push is very beneficial. For people that are feeling like they're very toxic, there's an amino acid, it's a tripeptide called glutathione, which is the primary detoxifier of the liver, so we can add that. And for people who want to have better quality skin, I mentioned to you how I had that acne. At that time, we weren't doing these IV essentials, and so I just did zinc the old-fashioned way, and it took me a year and a half, and I got my levels replenished. But probably with something like this, I could have done it in a couple months of doing the IV skin care. And then for people who are really depleted, we can do a combination of the nutrients. And then if you end up doing a nutrient panel, a health panel, and you show special nutrient levels that are low, we can customize the boost that we're putting in there. So.
Skincare anti-aging kind of like?
Well, the question here, yeah, Phyllis says, is the skincare anti-aging? Nutrition is anti-aging. Nutrition is anti-aging. How many of you have heard of someone that maybe they lost their job, or they went through a divorce, and in like a couple months it looks like they've aged in several years? Well, with stress, you tend to lose or flush the nutrients that you have in your body much faster. You use them up. And so by taking additional nutrition, you can literally slow the aging process. And I think what we're trying to do here is provide the skin better support, better reserves, and then that slows down the rate of wrinkle formation and other skin deterioration. A lot of the brown spots that you see on people is really free radical damage to the skin. And so these types of nutrients act as antioxidants, and they help regenerate the normal functioning of the skin. So this is taking the basic IV nutrition, IV essentials, and you can customize it by adding these particular boosts. And so if you happen to do these different panels, the IV nutrition plans can correlate with the panels. Not necessarily, but that's one way that you might be able to make some decisions in that particular area. So any questions about the IV nutrition? This is the newest and probably the most exciting program that we have going here at the center. Probably, how many, for those of you that are here tonight, how many of you, this is the first you've ever heard of IV nutrition? Yeah, okay. Did you know in Japan they now have IV cafes? We're not going to quite go that far, but I have made 3 trips over to Japan in the last year and a half, and the Japanese, which are they're willing to try new things, they have got a college of IV nutrition that now has over 400 members. And I know from talking with Dr. Yanagasawa, who's the president of that organization, that in the month before that I was there, Japan had imported 30,000 vials of vitamin C for IV vitamin C. So they're really taking off with the whole IV nutrition approach. So, okay, I'm going to let Brian go ahead. Any other comments, Brian? Or
Not particularly, but I do think it is a great product. I'm very happy that Dr. Ron has come up with this program. So, and I should not have been my own.
don't get me wrong. Okay. All right, I'm going to.
I apologize.
Quick question.
So if you do these IVs, how often do you do them?
Okay, the question is, how often would you do the IVs? And part of doing IVs, you would need to come and visit with one of our doctors and receive a baseline assessment, and we'll have you fill out a medical questionnaire. And so we'll visit with you and get to know you and find out what your issues are, what kind of problems you're dealing with. And so we would, as a center physician, help you decide what might be the best IV and how often you might want to do it, depending upon what condition you're trying to deal with.
Typically, how often?
Typically once a week.
Vitamins daily, so I was just
Yeah, typically once a week, but some people come in twice a week if they're under stress or needing a faster attention. With the center doctor, it would include the pre-diabetes panel. I'm the co-author of a book called Stop Pre-Diabetes Now, and that is the fastest growing epidemic here in the United States. Over 45% of Americans probably have pre-diabetes, and many don't know it. But you can tell if you're having fatigue, if your blood pressure is going up, if your belt line is going up, if your cholesterol lipids are out of control or your blood sugar is starting to get higher, you could be a candidate for pre-diabetes.
To learn more about nutrient testing, IV nutrition, and the concepts expressed in this presentation, please visit www.riordanclinic.org.